Hey folks, Dr. Joe Esposito here. I am glad you're with us today. Today, we're going to start out talking about kidney problems. Now, I've been in practice a long time, and years ago when I got in practice, I didn't see a lot of patients with kidney problems. But these past maybe 5, 7 years, I've seen so many patients coming in with kidney issues. And many times they're already in stage 3 or stage 4 kidney failure. And they don't know it because they don't know what signs to look for. And when I was studying orthopedics, and I've one of my several boards that I have, I remember my teacher, Rick Ackerman, said, if you don't know it exists, you can't diagnose it. And so I want to give you some warning signs to look for when it comes to kidney issues, and then what to do about it, which is really the most important thing. Because if it gets into stage 3 and stage 4, sometimes it's a little harder to deal with. Now, we've gotten some results with stage 3 and stage 4 cancer, kidney problems, but the quicker we get to it, the easier it is for the body to heal. So let's go through some signs. You might be victims of some of these things. One of them is you're tired all the time. Now, this can be a lot of different things. You're not sleeping enough. You're not eating right. You're stressed out. So this could be part of kidney issues, could be other things too. But kidneys, what they do is they filter waste products out of your body and then you pee them out. So when your kidneys don't work right, you can build up a lot of toxins. And one common tip-off is fatigue. Now, again, it could be a lot of other things too. If you feel spent, you're weak, you have trouble concentrating, the kidneys release a hormone that tells your red blood cells to produce, tells your body to produce red blood cells. If you have fewer red blood cells, you might not be able to deliver as much oxygen to your muscles, and that can be an issue. So if you are anemic, we have to look at several things. Could be internal bleeding in the body, could be kidney issues, could be you don't have enough iron in your diet, could be you're not absorbing your iron. So it's a lot of different things, but that's just one of them. Another one, of course, that is very general is poor sleep. Studies show that a possible link between sleep apnea and chronic kidney disease. Sleep apnea is when you gasp for air. You usually wake yourself up doing that. Over time, that damages your organs, which can lead to kidney failure. Again, sleep apnea may hurt your kidneys by preventing your body from getting enough oxygen, or chronic kidney disease may cause sleep apnea because it narrows down your throat and toxic buildup can occur. You're not getting enough oxygen. So it's not necessarily just because you're tired you have kidney problems. But what I teach my doctors, and we have a lot of doctors that have interned under me over the years, and what I teach them is we're detectives. We got to take all the pieces of the puzzle and put it all together to determine what's the puzzle going to look like. So we look at this and we say, okay, got a lot of this, what could it be? It's kind of like one of those TV cop shows. Itchy skin. Now, this one is more common with kidney issues, many times with liver issues as well, but the liver and the kidneys do what? They detoxify the body. They get junk out of the system. And if the junk can't come out of the system, I use that term loosely, the quickest way out is through your mucous membranes, your breath. Then your urine and your feces, and then your skin, with women in menstrual cycle. So those are the ways the body gets rid of waste products. And if your kidneys aren't working, the waste products may not be coming out through your urine. They can come out through your skin. That can cause a rash, make you itch all over. Over time, your kidneys might not be able to balance the minerals and nutrients in your body, and that can lead to mineral loss and actually bone disease like osteoporosis. And that can also then lead to more toxicity coming out through the skin and making your skin itchy. Now, if you have an itchy spot, it's probably not it. But if the whole body itches and it's a rash, it's again, could be caused by a lot of different things, but we say, okay, let's put this in the possible kidney problem. Swollen face and feet. Now we're getting a little more specific when it comes to kidney issues. When your kidneys don't get rid of sodium properly, the fluid builds up in your body. That can lead to puffy hands, ankles, legs, puffy face. You might notice swelling, especially in your feet and your ankles. And protein leaking out into your urine can also show up as puffiness around your eyes. So you can get just this whole puffy, itchy skin thing. So once again, we look at a patient, we go, okay, what's going on here? If the whole body is itchy, the whole body is puffy, they're tired, they have trouble thinking. We're going to talk about that in a second. Muscle cramps. Now we start to say, maybe we want to do a kidney study. And again, we don't do kidney studies in our office. I'd send you out to a urologist. But these are just things that I want any primary doctor to know to look for. And that's what we do. We look for things. And if we don't do it in our office, we then can refer it out. I had an attorney send me a message today and said, do you do a certain type of treatment? I said, no, we don't do that treatment here in this office. However, these are doctors in the area that I know who do. And so we work very closely with a team of doctors all around, well, especially in the Atlanta area where our office is, but we have doctors around the country that we can refer to so that nobody can fix everything. We get referrals almost every day from other health professionals, and that's why we all refer back and forth. Years ago, doctors didn't like to refer. Chiropractors didn't like to refer to medical doctors. Orthopedists didn't like to refer to neurologists. Neurologists didn't like to refer to neurosurgeons. And that's all gone now. Most doctors are very, very open and liberal with their referrals because our goal, certainly my team of doctors, our goal is to give you the best treatment possible. So other things that we see a lot of course, as chiropractors and pain management experts, is cramping in your leg. That could be a sign of kidney function problems. Imbalances in the level of sodium, calcium, potassium, other electrolytes can disrupt the nerve function and the muscles can spasm. Is it the only cause of muscle spasms? Absolutely not. Breathlessness. This is important because your oxygen, you may not be making enough red blood cells. We said that earlier. So there's a hormone that's produced, erythropoietin, and that hormone is really made in your kidneys, and it signals your body to make red blood cells. Without it, you can get anemia and shortness of breath because, again, you're not getting enough oxygen. In serious cases, lying down may make you feel like you're drowning because you just don't have enough oxygen because you don't have enough red blood cells. If that's the case, we have to start thinking why. Kidney issue, lack of iron, internal bleeding. I've seen that before too, where doctors can't figure out why the patient's anemic. Kidney tests are fine, diet looks good, they're bleeding in their colon. And so now we may have to go with gastroenterologist involved to see if there's any bleeding involved. So once again, we have to do a little investigation on every patient that comes in to try to give them the best treatment possible. No doctor's perfect. No doctor's going to get it right every time. But the more you know, the better off you're going to be. Foggy head. People come in, Dr. Joe, I just feel foggy all the time. I got brain fog. If your kidneys don't filter out waste from your body, the toxins can build up in your body, and that affects brain function. Anemia may also block the brain from getting oxygen it needs. You might feel dizzy. You might have trouble concentrating, memory issues. You might become confused and troubled with something simple, like opening a door. You might forget things. So again, it could be other issues too, but we always want to look at, okay, what else could it be? Now, with brain fog, this amazes me because I watch people eat. Obviously, it's something people do all the time. And I'll go to grocery stores and I'll look in baskets and I'll go, oh my gosh, you're not going to eat all that, are you? And so many patients come to me and they say, Dr. Joe, I just feel tired all the time. I got brain fog. I'm just not concentrating. And we look at their diet. And I don't know how people survive. They certainly don't thrive. But how to even survive with some of the junk I see people eating every single day. It blows my mind. I mean, I say, if I have a piece of bread, I don't feel good. Now, I look at people, and most people are so sick all the time that they don't realize that there's something better out there. They're in a bad relationship with food. And so they don't want to get out of this bad relationship. So what I try to do with our patients, in fact, every patient that comes in, we do a chiropractic workup, we can do a medical evaluation if we need to, and we can do a nutrition evaluation on everyone. So many times, patients will say to me, Dr. Joe, I took your advice, or maybe just listen to our radio or a podcast or whatever they're listening to, and they'll say, Dr. Joe, I took your advice. I'm amazed that all I had to do was, give up wheat and dairy products. I feel so much better. My brain is so much clearer. I'm sleeping better. My love life improves. I'm losing weight. I'm going to the bathroom better. My breath is fresher. Everything changes when you put good chemicals in your body. If you put bad chemicals in your body, everything changes too. So the kidneys detoxify the body. But whether your kidneys are working right or not, if you just keep dumping junk into the body, you're not really going to get the results that you're looking for. And that's something I want you to think about. Why am I so tired? Look at your fork. What's on the other end of that fork? Is it alcohol, meat, sugar, dairy, coffee, soda, artificial sweetener, breads, cookies, cakes, donuts, pastas, tortillas? That's not good food. If you're eating fruits, vegetables, nuts, and seeds, that's a real good food. And I also want you to have something raw at every meal. Broccoli, cucumbers, tomatoes, avocados, salad. And that's one of the things we can do for the kidney. Because the big question people have is, how do I prevent this? Well, the best ways to prevent kidney disease is reduce your risk factors. The best way to reduce any disease is reduce your risk factors. So if you're overweight, if you're not getting enough physical activity, if you're on a low-fat diet, that can affect how your body works. Now, I'm not a big fan of a low-fat diet. I want you to get fat in your diet, but I want you to get it from whole foods, not the store, the whole food product, an avocado, a nut, olives. Olives are high in salt, though, so be careful. So these are things that are associated with chronic kidney disease. If you have uncontrollable risk factors, family history, type 1 diabetes, then you can help prevent chronic kidney disease by changing your diet. So real simple, you want to reduce the amount of salt you eat. You should do that anyway. Added salt, not a good idea. I've had one patient say over the years, well, if I don't add salt to my diet, how am I going to get sodium in my body? You're going to get sodium from other foods too. And if you're eating a good plant-based diet, which you should be, you're getting plenty of sodium. If you're eating meats and dairy products, they have urea in them, urine basically, and that has sodium in it too. So I know you always joke, I used to give lectures on slicing open a steak. You slice open a steak and the blood runs out, which is pretty disgusting, but there's clear fluid that comes out too. That's interstitial fluid. Urea is in there. Urea is basically urine. It's urine. It hasn't made it, the cow hasn't peed it out yet. And so when you're eating meat, it has natural pee in it, but that also has sodium in it too. It's another good reason not to eat meat. So reduce your amount of salt. And what you'll find is with anything that sugar, salt, whatever you do a lot of, when you eat a lot of it, your body downregulates the receptors. What that means is you're less sensitive to it. So I'll have people change their diets and they'll come back and say, Dr. Joe, I tried eating a cookie the other day. It was way too sweet. We upregulated your dopamine receptor sites and your sweet palate, and it was just too much for you. When you eat it all the time, the body says, that's too much overload. I got to downregulate my receptor sites so it's not as exciting to me. And that's what happens. So that's why when you eat a lot of sugar, you want to eat a lot more sugar because it's not as stimulating as it used to be. Just like drugs, just like heroin, just like cocaine, just like cigarettes. I never smoked. I don't know that. But whenever you put something in your body eventually gets used to it. So that's why you got to be careful with that. So cutting back the salt, you'll find that other things taste a lot saltier. So that you'll just downregulate that. So avoid adding salt to your food, of course. Be careful of your sodium content. Prepackaged foods, a lot of them are loaded with salt. They're also high in something called glutamic acid. Glutamic acid, you might know it from monosodium glutamate, glutamate part, but autolyzed yeast, hydrolyzed vegetable protein. I cannot tell you how many patients, when I get them off those processed foods, their headaches go away. I'm one of them, okay? I can't do processed foods because if I do processed foods that have autolyzed yeast and hydrolyzed vegetable protein in it, I get a blazing headache. And so that's why I always tell people, keep a diet diary, write down what you're eating, and then you'll see when the symptoms pop up. And it's usually pretty simple to figure out. So cutting out processed food is going to take the stress off your kidneys. Cutting out alcohol, I hope you don't smoke. If you do smoke, stop, of course. I know it's hard, but it's an addiction. If you don't know how to quit an addiction, whatever your addiction is, go to our website, drjoe.com, type in the word addiction, listen to the show we did on addiction. A really good show. I think you'll enjoy it. The other thing, and this is the easiest one to cut out to reduce your risk factor, is cut out animal protein. There are many, many studies out there that animal protein increases your risk of kidney issues. And if you have kidney disease or kidney failure, it just perpetuates it and makes it worse. Plant protein does not have the effect on the kidneys. It doesn't have a negative effect. So if I have, 20 grams of animal protein and I eat it in a certain amount of time, or I have 20 grams of plant protein, animal protein, negative side effects on the kidneys, plant protein, no negative side effects on the kidneys. So one of the easiest things you can do is cut out your animal protein. Hey, wait a minute. Dr. Joe, I've heard you say this before with, you fill in the blank, cancer, heart disease, diabetes, obesity, fatigue, sleep issues, sexual issues. It keeps coming back to the same thing. The more animal protein you consume, the higher the risk of just about all diseases. The lower amount of animal protein, which ultimately would be zero, the lower the risk of most diseases when it comes to your diet. And when it comes to the kidneys, this is a biggie. So I've had people in stage 2, stage 3, stage 4 kidney failure say, listen, I don't have a cure for kidney disease. But I will tell you, if you cut out your animal protein, let's monitor your kidney function and see how you do. Inevitably, they come back to me and they say, Dr. Joe, I did what you said. It's been 6 weeks, 8 weeks, 2 months, 4 months, whatever. I went back to my urologist or my nephrologist, kidney doctor, and they said, the numbers are looking better. What did you do? And they say, well, I talked to Dr. Joe Esposito and I followed his plan of, more plant-based, less animal protein diet. And inevitably, the doctors say, well, keep doing it. It's obviously working. I've never had anyone argue with me that when I can show them on their blood work that it's getting better to say, well, I don't want to do that anymore. If you want to, it's your choice. It's your body. Your body, your choice, right? It goes all the way across the board, folks. If we're going to do it one direction, we got to do it in other directions too. So I want you to eat the best diet you possibly can. I want you to eat a good, healthy, plant-based diet that's really going to reduce stress on your kidneys. And animal protein and liquor is the worst, alcohol. The other thing we look at for kidney patients is pinched nerves. The nerves in the mid-back, right around T11, T12, thoracic 11, thoracic 12, that's the nerve supply to the kidneys and the adrenal glands. So part of a protocol is you always want to check the nerve supply to whatever organ is being involved. And if it's pinched, we, the chiropractors, can unpinch those nerves in most cases, open up the nerve supply to the organ. Then we add the good diet. Then we drink water. Kidneys like to work. Okay, so you drink water to flush out the waste products and the toxins. And then there are certain supplements that I've given to patients in the past. We don't have any in the Dr. Joe line. Well, for Dr. Joe, I always recommend Super Green's an essential source because it alkalizes the system. And if you're eating a lot of acid, acid can irritate the lining of the kidneys. It's like pouring acid on anything else. So cutting out your acid foods, alcohol, meat, sugar, dairy, coffee, soda, and artificial sweetener, and then increasing your alkaline intake, fruits, vegetables, nuts, and seeds, that has a tendency to help. It's not going to fix it. But now we're putting together a plan to get the kidneys working well again. And the cool part is the same plan works for just about everything. Eating more fruits, vegetables, nuts, and seeds. Supplement-wise, Super Green is an essential source of the minimum supplements everybody should be taking, in my opinion. So if you're not taking Super Green as an essential source, you should. It's the most expensive, least expensive, most effective supplement that I know of on the market today for an overall supplement. Now, I customize my supplement plan. I'd like to customize one for you too. I take adrenal support. Now, the adrenal glands sit on top of the kidneys. They're not part of the kidneys necessarily. They're kind of indirectly pseudo-kidney parts. And the adrenal glands burn out as time goes on. The adrenal glands produce anti-inflammatories, and anti-inflammatories can help reduce inflammation everywhere, including the kidneys. So I take Super Green Essential Source. I take nitric oxide to open up my blood vessels. I find that seems to help with some kidney patients because it takes the pressure off the blood flowing through the kidneys because it opens up the blood vessels. Now, it doesn't take all the pressure off, of course, but it opens up the blood supply to the kidneys. So nitric oxide, I take it for multiple reasons. Increase brain function, increase energy, increase flow to every part of my body. So I like that. I was at dinner with a very good friend of mine on Friday, and she leaned over the table and she said, I am addicted to those nitric oxide supplements. She goes, I feel so good when I take them. And she's 60 years old. So the nitric oxide levels are dropping as we get older. And so I said, I'm very happy, Tony, that you're doing so well with it. And she goes, I am just so excited because she doesn't want to do stimulants like caffeine and things like that, which you shouldn't either. Nitric oxide is great for opening up blood vessels, but also giving you a burst of energy and the brain function. Also, it helps in other departments romantically because it opens up the blood supply to all the parts of the body. So lots of benefits to nitric oxide. So those are some of the supplements I take. I take omega-3 fatty acids every day to reduce inflammation and to help my brain work better. I take digestive enzymes. Whenever I eat a cooked meal, I eat digestive enzymes. Now, my garden put out a lot of figs and tomatoes. You can only eat so many figs, folks. It can tear up your guts. But tomatoes, I ate tons of raw food. And it's great. Feel good, lose weight, have energy. It's awesome. But if I do end up eating a cooked meal, I will always go ahead and take a digestive enzyme with it. It's amazing what it does. I had Ethiopian food the other day with my friend Tim. And, of course, that's my favorite cuisine, if you don't know that. And it was really good batch that night, as we say. And I took my digestive enzymes with it because everything was cooked. There was a little bit of tomato salad that was raw, but it wasn't enough. So supplement-wise, we can do things to keep the body healthy. Again, I'm not saying I'm curing kidney disease, but this is just part of that overall healthy protocol. Other symptoms of kidney problems might be a low appetite. Kidney disease can cause nausea and vomiting and an upset stomach, bad breath, smells like urine, basically. So if your breath smells like urine, it could be that you're not detoxifying everything out of your body like it's supposed to. Foamy brown or bloody urine. If you see foamy brown or bloody urine, I strongly advise you get to a urologist right away. It's not a chiropractic case. It's not a holistic case. You want to go get a medical evaluation right away for that. Now, we can always do chiropractic and holistic and nutrition and everything else along with that. But if we start seeing blood or foamy urine or brown urine, that's something you want to get to an expert right away in that area. So chronic kidney disease, it refers to a form of progressive kidney disease where your kidneys gradually decline in function. And there's about 26 million adults in the United States who have it. That's a lot of people. 26 million. Those are the ones that are diagnosed. There's probably a lot that are undiagnosed too. So excess waste and fluids accumulate in the body. Kidneys can't work properly, and that can lead to a bunch of other complications. Now, it's usually not curable necessarily, but with any condition, I want to manage it the best I possibly can. So if you have chronic kidney disease, you might have increased blood pressure because the blood isn't flowing through the kidneys. It's kind of clogged up. Excessive fatigue, we talk sleeping problems, ankle swelling, forgetfulness, nausea, vomiting, muscle twitching, itchy skin. So many things go along with kidney. But when I start seeing puffy skin, itchy skin all over the body, and then we ask about urine issues, and maybe it smells like urine from their breath, then it's something that we have to be concerned about. Also, we have to check the nerve supply. And again, from a chiropractic standpoint, I can't understand for the life of me why every patient that comes into any doctor's office anywhere, unless they have like a bullet hole in their head, why they're not checking the nerve supply to the organ. Neck pain, back pain, shoulder pain, numbness, tingling, headaches. Everything is controlled by organs, by nerves. The brain is sending messages along the nerves to every cell in the body. So if you have a pinched nerve going to your spleen, your kidneys, your ovaries, your prostate, your sex organs, your thyroid, that could be contributing, not necessarily causing, but contributing to the malfunction of that organ. And it's the quickest, easiest, least expensive treatment for back pain is chiropractic care. And along with the pain, we open up the nerve supply to the organ. So my doctors and we check the nerves that feel pain and we check the nerves that don't feel pain. And if the bones are out of alignment, they rub up against each other and eventually they wear out, and that's called arthritis, which pinches the nerves more. So if you have a health issue, neck pain, back pain, shoulder pain, numbness, tingling, sciatica, muscle weakness, you want to get your body checked to see how well it's working, make an appointment to come see us. The first visit, if we do everything, exam, x-rays, consultation, adjustment, going over the x-rays, nutrition evaluation, it's right around $700. We've reduced that to $299. So if you want to make an appointment, you can do it right online on the website, drjoe.com. We are more than happy to set you up an appointment. In the Atlanta area, we have offices in Marietta, Duluth, Stockbridge, and West Cobb. We accept most insurances, almost every insurance. There's one or two that we don't. Medicare. So we do everything we can to make it as easy and affordable as possible for you to get well and stay well. Now, the supplements I talked about today, they're all available on the website, drjoe.com. We have them in all the offices, too. So you can order them, and Joe is in charge of our shipping. We'll ship them out to you probably the day you order it, unless it's a weekend day. Or you can come by and pick them up. If you come by our offices in Marietta, Duluth, Stockbridge, or West Cobb, you can pick up the supplements, and that saves you shipping costs. Either way, we're happy to get them to you. Shipping is very nominal. Whatever they charge us, we charge you. So we try to make it as easy as possible for you to get the supplements, and we try to make it as easy as possible for you to be a patient. And if you've ever been in a car accident, folks, if the car was damaged, you were damaged. I've never seen it any other way. So if you're in a car accident, you need to come see us immediately, the quick as you can. The faster you get to us, the better off we're going to be. Because the insurance companies have this little game they play where they say, well, you didn't go to the doctor right away, so we're not going to pay your bills. Get to the doctor right away. And even if it has been a couple of weeks, come see us anyway. We oftentimes know the verbiage to use to get the insurance companies to back off a little bit. I've been doing this for 37 years now. I'm getting good at it. I teach other doctors continuing education on car accidents, on nutrition, on biochemistry, neurophysiology. You get all this for free. So if you have any questions, you can send it to me through the website, drjoe.com. We're available, and we'll try to get back to you right away. If we don't answer you right away, we'll get back to you as soon as we can, so make sure you put your email address in there. But most important thing is make an appointment. drjoe.com. We have offices in Marietta, Duluth, Stockbridge, and West Cobb. You can call us or book the appointment right through the website. You'll see little places on the website to book it. I'm Dr. Joe Esposito. The website again, drjoe.com.